The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Excellent. Thanks so much, Ashton, and great to be with you all tonight. We're discussing a really important topic for a lot of men, which is erectile dysfunction management. One of the most common reasons why individuals will come to see a urologist or a urologic health professional. So we'll get right into things. We'll first talk about the physiology regarding erectile dysfunction, and then we'll go a bit into management, specifically injection teaching. We'll do a demo, and then we'll have some time for questions and answers. So a brief discussion about how erections occur, because this is going to be important for some of our later discussion about the injection technique. So typically, if you kind of direct your attention to screen right, you'll see two different versions of the penis, one in a flaccid state or a non-erect state, and one in an erect state. So typically, when arousal occurs, you have nerves that basically stimulate some of the penile tissue to become more active. The muscles around the blood vessels, called the arteries, these are ones that deliver the blood flow into the penis, they will start to relax and more blood flow will go into the penis to cause engorgement. As this happens, more blood fills the penis and it actually cinches off some of the drainage from the penis. So that's what causes you to maintain an erection, ideally until a climax or the sexual encounter is over, which is not always the case, and this is why we talk about some of these therapies. But as that erection maintains its engorgement, the veins can't drain the blood flow from the penis, and we maintain an erect penile state. That's what you can see on the screen far right within the erection. So we're going to go into intracavernosal injection therapy, or ICI as it's termed. We'll start talking about some of the components of this and then go into the technique in more detail. So how do erectile dysfunction medications work? Well, similar to the normal process of delivering better blood flow into the penis to generate and then maintain an erection, these medications oftentimes work by either dilating the blood vessels or keeping the blood vessels dilated. So we increase blood flow into the penis from some of the smaller blood vessels at the base, and this was what gives us a stronger erection or maintenance of a larger erection. The injection liquid formulations come in a couple different components. So many injection mixtures for erections, they contain a combination of 3 or 4 components. So alprostadil is prostaglandin E1. This is a dilator medication that causes the muscles around the arteries to relax, delivering better blood flow into the penis. Papaverin is a different medication that works side by side to stop the breakdown of some of the microscopic molecules that contribute to that relaxation and blood flow into the penis. And then phentolamine actually is another medication that works similarly to stop the breakdown or relaxation of some of the dilation mechanisms that cause an erection. So there are a couple different popular formulations. Trimix refers to a liquid that we use to inject into the penis that contains all 3 ingredients. And Bimix is a different formulation that contains 2 out of the 3 ingredients. We'll go into this a bit more in a bit. So Bimix formulations, these contain 2 out of the 3 ingredients, papaverin and phentolamine. And through MenMD, we have a couple different formulations of these medications that vary in terms of strength or amounts of each ingredient. What we try to do as providers recommending these medications to you is try to figure out the best dose and the best strength of the medication to give you the desired response, which is a strong erection, but not a dangerous, long-lasting erection. Trimix formulations, which contain all 3 ingredients, also come in different strengths. And we can recommend a starting dose and then talk to you about how to dose escalate that medication to give you the desired response. Most individuals find the right dose and then stick with that dose each time they use it. It's important to note that, alprostadil, which is the ingredient that's different between trimix and bimix, can cause some sensations that may be uncomfortable for some individuals. About 20% of men may describe a little bit of an aching sensation in the penis when they use this medication based on how it's working to deliver the blood flow in. In that type of situation, we can either do a lower dose of the alprostadil in our trimix, or we can recommend bimix, which does not have the alprostadil, to alleviate that response. So the needles that are used for injections also come in different calibers or sizes, as well as different lengths. The reality is that a lot of these needles are very tiny, similar to the types of needles that are used for insulin injections. They're meant to basically be a certain depth that just goes into the penis and makes this very easy and straightforward and relatively painless to deliver the injection therapy. So this is a picture of the syringe on screen right. You basically have a plunger, which is at the back part of the syringe. You pull that plunger, and that pulls the medication in. And we'll go over a little bit of this technique. And there's a way that we'll measure the specific dose and talk about starting doses and how to advance some of that dosing. When you order a trimix or a bimix medication, you will actually also typically get a prescription for these specific syringes, and we can modify the sizes for you as to what works best. In terms of the volume, it's important to note that a milliliter or an ml is the same thing as a cubic centimeter or cc. So your physician may describe a cc or an ml. They really are the same thing. So what's really helpful with some of the Men&D interfaces is in your kit, you'll actually see sometimes a card that's provided for you that will have some set instructions. And typically your provider will go over the teaching with you as to how to do the initial injection and how to adjust the dose that will work best for you. So if you look on screen right, you have kind of a rigidity scale. And this is kind of where we ideally will try to get you in terms of strength of an erection. So on the left side of the rigidity scale, you basically see that there's not much change in kind of the rigidity of the penis or blood flow into the penis. A score of 6 kind of indicates that the penis is firm enough for penetration. And we want to have you in kind of a 7, 8, 9 range, which is a firm enough erection, but not overly rigid where it would cause pain or a prolonged erection risk. And we can adjust the medication dose based on what type of dose is giving you the best response. So our provider team, as well as some of the counseling options you have available either through Men&D or otherwise, can help to work with you throughout this process. I think most individuals who do this have an initial hesitation trying to wrap their head around, I'm giving myself an injection with the medication, specifically into the penis. But the majority of men find that this is actually a very straightforward option and a very good option that gives them a desired response. So it's really important that you stick to the specific dose and the maximum dose that is indicated by your provider who prescribes this. The risk of going over can lead to an increased erection that lasts too long and can be dangerous to the blood flow of the penis. In some cases, can cause permanent damage to the penis. So make sure you stick with the instructions, and your provider team will talk to you about exact kind of dosing here to minimize that risk. And then it's also important to note that you don't use this medication typically more than once every 24 hours. The reason for that is your body processes this medication and breaks it down. And if you use the dose too frequently, some of the previous dose may still be left over, and you're adding increased dose on top of it, which can give you undesired responses. And then typically we try to minimize the amount of times we're using this to 3 or 4 times a week or less to try to minimize an in and out puncture at certain areas that can lead in some situations that are rare to scar tissue formation. So we'll talk a little bit here about how to prepare for our injection. As is the case with most things, preparation is really key. So we want to have all of our supplies lined up, and I'm going to show you this in the demo portion of our presentation today. So you'll typically be given a vial that has the medication. We'll talk about how to draw out the medication from that vial. You'll have your syringes, and then you'll have an alcohol prep pad that you'll clean the top of the vial. vial with, as well as the penis tissue where you're going to be doing the injection. So in terms of getting the syringe ready, we'll show you this in person in just a little bit, but basically there'll be a cap at the tip of the needle as well as a cap over the plunger, the portion of the syringe that you pull the medication back with. You want to basically, when you're ready to go, have both the cap at the tip as well as the cap on the plunger taken off. To draw the medication, the image at the bottom of the screen on the right is a really good one. So you want the medication vial to be tipped upside down. So all the liquid goes with gravity down to where you'll be drawing that out. The needle of the syringe goes into the plunger, and then basically you're going to pull out the medication. In some situations, you may notice a little bit of an air bubble in the syringe. We want to get rid of that. So a good technique, again, look at that picture on screen right at the bottom. When you have the syringe here, okay, which is my finger, and there's a little bit of an air bubble on the top, you can either simply flick that syringe to get the air bubble to rise, or push the air bubble out using the plunger from below. We'll demonstrate this technique. So in terms of the injection therapy, where you inject is really important because there's ideal places to do this and there's less ideal places to do this. So if you'll refer to the picture on the right-hand side of your screen, we basically always want to clean the surface of the skin on the penis with an alcohol swab or an alcohol wipe, and then let that area dry, which should only take a few seconds. We insert the needle at about a perpendicular angle, so meaning, from the side of the penis tissue, you're going to come straight in with that needle tip. Oftentimes, we're going to either go all the way in with the needle or very close to all the way in. And we'll modify the needle length to make sure that it's comfortable for your anatomy. You want to inject, if you think about the penis like a clock face, okay? 12 o'clock being at the top, 6 o'clock being at the bottom, and 3 and 9 o'clock being on the sides. The ideal place to inject would be at the 3 or the 9 o'clock position, right on the sides, up to about the 1 o'clock or the 11 o'clock position. That keeps you away from some of the other structures in the penis that you don't want the injection to go into. So if you think about it, from the side is where you want to go. At the top of the penis, you have some of the nerves and the blood vessels that you want to stay away from when you inject this medication therapy. At the 6 o'clock or bottom part of the penis, you have the urethra, which passes the urine. And that's, again, a structure that you want to stay away from because it's not going to be the ideal place to place the medication. So you'll push the medication all the way in once you've pulled it up in the syringe in one full movement, and then you'll take the needle out and you hold a little bit of pressure with your finger or your thumb. Again, I'll show you this. We typically recommend up to 2 to 3 minutes. You want to basically just hold a little bit of pressure, similar to if you had a small cut or a nick on the skin surface, just to make sure that everything is kind of sealed up. And then the medication will work with stimulation similar to, pill forms of medication or any other type of sexual encounter. So side effects can be expected with all different types of medications. In general, the benefit of doing an injectable therapy into the penis is it typically keeps that medication a bit more localized than, say, a pill that circulates that medication throughout the body. So we'll talk to you about, when you meet with your provider team, about the right dose to start out with and how to increase that dose. So we go from low and slowly advance up to find the right dose as opposed to starting high, because the risk of side effects with a lower dose would be much lower than if we started at a higher amount. We'll teach you a proper injection technique, which we'll go over tonight as well. You may also want to inject at different areas of the penis. We typically recommend that you inject at the base of the penis to about a third of the way up towards the tip of the penis. So you want to kind of aim for the part of the penis that's closer to where it connects to the body. And you may want to inject at a couple different sites each time that you use this medication to try to minimize scar tissue formation in those areas, which is a low but described risk of injection therapy. And again, don't want to use this medication more than once every 24 hours for the reasons we discussed. It's important to state that when you are storing this medication, it works best if you store it in a refrigerated area. If you keep the medication cold, this will keep it lasting the way that it needs to with all the components. And then most injection therapies are good for about 28 days after you do the initial puncture. So in terms of different accessories that can help you, we'll go over a couple of these options, some of which are available through MenMD. So we have our Insula tote, which is basically, this is a nice package that basically discreetly packages your injection supply so you can take it with you. There's a couple different pockets that we can use for our syringes as well as the medication, and you can put it in the refrigerator too to keep things cool. So a nice way to keep things organized in a discreet fashion. To the screen right at the top, we have Insules. Basically, this is a magnifier device that really lets you see the right dose that you're pulling up to make sure that you're kind of right on the mark in terms of how much medication you are drawing up. There are auto injectors and easy injectors, which we'll go into a little bit in the demonstration portion. And there's also a sharps container, which is really helpful because you can basically safely store the needle when you're done, put it in here, close the lid, and it keeps the needles kind of out of the way of, just being on the table or being out of the way of other individuals who may be at your house. And it's also a really great resource that's available through MenMD specifically, where you have some personal health assistants that can work with you on answering questions and providing some technique, insights or tips as you're going through injection therapy. So I would encourage everyone, this is a great resource to have. You can either go to menmd.com through the portal, or you can call the number that's listed here to ask for any assistance or questions that you have as you're going through this. Your provider teams are also great resources for this, and I would typically tell you to work with us on this because the more information you give us, the better that we can tailor these therapies for you.
Alrighty, that brings us right up to our live demo.
Perfect. So I'm just going to adjust the screen here, make sure everybody can see me well, and we'll go into some of the demonstration in terms of how to appropriately administer this medication. Then we'll go into a question and answer session at the very end of the presentation. So I'm just going to pull up a couple different things here that we'll kind of go over together, okay? So here I have kind of a penis model, all right? This is what we're going to use when we do the injection therapy. I'll show you the appropriate technique in terms of how to draw up the medication first, and then we'll do a couple sample injections to show you do's and don'ts, okay? So when you get your MenMD kit or your injection trimix or bimix therapy kit, you'll notice that the medication basically comes in a medication vial like this. So you will open this up, and the medication will basically have a small diaphragm on the tip of this, okay? So what this is it's a rubber small area that's where the needle is going to go. So at the top is where you're going to notice this gray circle. That's where you're going to insert the needle. Again, insert that there, and then that's going to be how we're going to draw the medication. When we are drawing out the medication, it's really important that we have the medication vial flipped upside down and then draw up the medication from down below. This basically, you can see that air rises to the top, so that's going to minimize our chance of getting any air bubbles in. Again, we want to have all liquid in the syringe at the right amount. Your syringes are typically going to come in a bag, and it's going to come with a supply of a number of these different types of syringes. Here we have one version of this syringe, which I'm going to kind of show you some of the numbers here, okay? So this is a 50 unit syringe, and there'll be a specific dosing for the amount of units that we're going to use here. The reality is that this is about a half cc or a half milliliter, which is 50 units. And typically we'll kind of start low at certain increments, and then we're going to build up until we get the desired dose. There are two caps on these syringes when they come to you. There's a cap at the top that basically reveals the needle. You can see that these needles are very thin and tiny, and they're actually, when you put it up to your finger, pretty small. So when we go in, you'll either push the needle in all the way or part of the way, and then inject that medication therapy. So I'm going to recap the needle just for safety's sake, and then at the bottom, there's actually also a syringe, a cap that comes on the plunger of the syringe. So I'm going to show you just what the syringe looks like when we draw out the medication without necessarily drawing out the liquid. So I want you to pay attention to this black area at the top of the syringe. You'll notice that that's kind of all the way up at the top. So when I have my medication in the vial, okay, and I'm drawing up the liquid, okay, so I puncture into this gray area here, and then I'm going to draw out the medication. I want you to basically see what this kind of looks like, though, in terms of that plunger, okay? So when I draw up the medication, you're going to notice the top part of the plunger is where the liquid is going to fill to. So if I wanted 10 units, I would simply pull the plunger at the bottom down until I reach 10. If I wanted 20 units, I would basically pull down to 20, and so on and so on. Typically, we'll come up with small incremental doses. So if we tried 20 last time, it didn't get you the desired response. You can go to 25 for the next dose 24 hours later. Then you'll go to 30, the next dose until we find the desired dose. Again, it will be really important. Your provider team will talk to you about the maximum dose to not exceed. All right. And so we're going to basically start out at a typical dose here, okay? And again, this dose may vary from person to person. You'll work with your provider team, okay? So basically, we're going to draw out this medication, okay? I'm going to say we're going to start out at a 20 unit dose. So we're going to pull that liquid down, okay? And that liquid is basically filling until that top black part, okay? I'm going to see if I can turn it for you, is at the 20, okay? And what I'm going to do there is I'm going to make sure that there's no air bubbles, okay? If there's air bubbles that are in the syringe, okay, I gently flick the syringe to get them to the top, and then I will basically take my hand and I will push the plunger up to get that air out, and then draw out a little bit of liquid until I'm all the way full with liquid and there's no air bubbles. Then I'll take my syringe out, okay? I'm going to set the syringe down just to show you a little bit about the areas that we're going to be injecting on the penis before we actually do it, okay? So if you have the penis here, okay, and we're looking at the penis like a clock face, all right? We have the 12 o'clock position on top. That's a don't inject there because you have the nerves and the blood vessels. You have the 6 o'clock position on the clock face underneath. Don't inject there. That's the urinary tube. We want to aim for 3 o'clock or 9 o'clock position, or 1 o'clock and 11 o'clock position, somewhere on the sides, okay? In terms of where along the length of the penis you want to inject, you're basically going to try to aim for the bottom third, okay? So closest to the body, about a third of the way up. And that's where you're going to inject either at the 3 o'clock or the 9 o'clock position. If you are right-handed, you'll use typically your left hand to extend the penis, okay? And then your right hand to inject. If you're left-handed, you'll kind of do vice versa, where you stretch the penis or hold it kind of flat so there's no bending or redundancy, nice flat tissue, and then you'll use your left hand to inject. So I'm right-handed. I'm going to show you a right-handed demonstration, okay? So when you're ready to go, we've cleaned the penis surface with the alcohol swab, and we've cleaned the bottle beforehand and pulled out our medication, okay? We have our syringe ready to go. There's no cap on the bottom. There's no cap on the top. And then basically, we're going to basically put this on the lateral position, okay? As this is kind of my clock face moving away from me, this will be kind of like a 3 o'clock position here, okay? So I'm going to turn the penis to the side. We're going to go for the third of the penis that's closest to the body. And you're going to basically put the needle, I'm going to come in a little bit closer so you can see this. We're going to put the needle, okay, directly into the penis tissue, okay? All right, and I'm going to kind of turn that to you so the needle is completely in. And then there's one full push with the medication all the way in until you see that black portion of the syringe all the way through. You pull the needle out, and then you simply will, either with the alcohol swab or a small piece of gauze or your finger, just hold a little bit of pressure over top of that area, similar to if you had a small nick or cut on the skin surface. You will hold that typically for 30 seconds to up to about 3 minutes, and that will be enough to seal up that area. Okay, you can put a small Band-Aid on if you want, but typically is not necessary. Okay, and at that point, we'll still require some stimulation. You'll typically still do this in anticipation of sexual activity about a half hour or so before, but the timing of this may be variable from individual to individual, so it may take a little bit of a trial and an error. Okay, if that dose has not been satisfactory to you, okay, we would go and basically pull up another dose. All right, so we started at the 20 milligrams. We could go to, say, a 25 milligram dose the next time, or 30 milligram dose the following time. So your provider team will write you some instructions and work with you on this, and we're always available to kind of go over this further. Okay. So that's kind of injection therapy in a nutshell. Is pretty straightforward, and a lot of times, when we're doing the initial injection therapy, we'll demonstrate this technique with you in the office and make sure that you feel nice and comfortable with it. I think most individuals who have done this just a couple of times feel like this is pretty straightforward to do and relatively quick and painless, get some very good desired results in many cases, and can be titrated if it's still not perfect. So we can talk a little bit about some of the other options. I know that there is a question and answer session, and I'll go over some of the auto injectors and things like that as questions come up. But that's our demonstration portion. If we're ready, we can go into the question and answer session.
We certainly are. Alrighty, we're going to start off with some general injection therapy questions. So first question here. This person wants to know, with injection therapy, why do you lose your erection sometimes when you lay down?
Yeah, so good question, right? So erections happen for a couple different reasons, okay? So again, the blood flow into the penis is a critical component there, but what can also happen is sometimes the veins that would hold the blood into the penis are a little bit leaky, or you may also not be able to hold the blood flow into the penis. In some situations, many individuals may see some benefit by adding what we call a constrictive band or a silicone band that kind of sits at the base of the penis and basically mechanically holds the blood flow into the penis. So some people will use injection therapy or medication therapy, get the erection, and then basically use something that will mechanically hold the blood flow into the penis. There are some surgical techniques that can help to correct that, but that may be one reason why that occurs.
Alrighty, and as a follow-up to that question, is it better to stand while developing an erection after the injection?
Yeah, so I'll say that it basically, for individuals, may vary there. Okay, most individuals, I think, when they're doing the injection therapy, may find it easier to be in a standing position because they can find it a little bit easier to basically, put the medication on a table, stretch the penis adequately without necessarily bunching or having the penis kind of go inwards in a seated position, and then inject that therapy there. But, there are plenty of patients who may do this in a laying down technique or a seated technique. The most important thing is to put the penis on stretch and to make sure that you, basically inject fully at that site when the tissue is not bunched. So whether that's standing or laying down, it basically can be variable from individual to individual.
Alrighty. Next question here. Can injection therapy continue indefinitely, or is there a time limit as to how long this therapy can be used?
Yeah, so very good question. We get this question a lot in the office. Most injection therapy, like other medication therapy, is typically effective at the same dose for, a longer term scenario. However, there may be some other factors at play. The same process that causes issues with getting an erection in the first place may still go on for some individuals. So these can be things like poorly controlled blood pressure, or age-related changes to the blood vessel, cholesterol issues, diabetes issues, smoking exposure that can deteriorate those blood vessels further. So it may require you to increase the dose of these medications over time to maintain the desired response, but they are meant to be kind of options that can be sustainable for individuals who wish to continue these. One other thing to think about is varying the sites of injections may help to minimize risk long-term of developing scar tissue or irritation at the injection sites.
Alrighty. Very good. So next question here, saw this a couple of times. What are a couple main reasons why someone may experience pain when injecting?
Yeah, so a couple possible reasons for this would either be sometimes injection technique. The body may be a bit more sensitive to those areas. When you're doing the injection, one thing to think about too is, right, you do have some smaller nerves that course along the skin surface as well as some smaller blood vessels, okay? You want to visually inspect the penis and try to avoid some of the blood vessels that may be running under the skin surface. Doing the right size needle is really important too. So you can do a smaller length for the needle, in using the right amount of medication, the right formulation of the medication may also help to minimize pain. As we talked about, alprostadil is a component of some of the trimix formulations that may cause a little bit of penile cramping. So if that's the case, we can reduce the amount of alprostadil or use a bimix formulation that doesn't necessarily have that component. About 1 in 5 individuals who use alprostadil may describe some penile cramping if that's the case.
Ready. So next question here. Saw this a couple times too. What is the approximate wait time before your erection subsides after the injection?
Yeah, so this is titratable, okay? So what I mean by that is we would start out with a lower dose initially, and we try to increase the subsequent doses to find the right dose that's going to give you a desired response, a rigid enough erection for penetration that is firm, truly firm, but is not lasting too long. So most individuals will try to dose their trimix to get them to the point where they can climax or finish their sexual encounter as desired, and then have their erection go down thereafter. We want to, at all costs, try to avoid a prolonged erection, which is basically an erection that lasts longer than 4 hours. If that's ever the case, you have to let your provider team know, because that may be an emergency that would require some type of intervention to reverse. So the ways that we can minimize that risk are, again, starting low at the dose and then increasing subsequent doses slowly until we find the desired dose. When we know your dose that works well and the formulation or strength of the medication that works the best for you, you will use that dose each time thereafter. So there's no need to kind of build up to that anymore.
Alrighty. And as a little follow-up to that, if you have an erection that's, let's say, lasted several hours and you're kind of getting close to that 4-hour mark, what can you do at your house?
Yeah, so very good question. So there are a couple options for trying to reduce that effect. One, you can take a cold shower or put a cold compress or ice over top of that area. The caveat to this is individuals who have sickle cell disease, that may not be the best technique. So if that is the case, I would not recommend cold compress or cold shower. Sudafed is an over-the-counter medication that actually has some ingredients that constrict some of the blood flow into the penis and some of the blood vessels. People use Sudafed for sinus pressure and headaches sometimes. So that is an option to have on standby. The one thing I will say about Sudafed is it can increase your blood pressure too. So make sure that that's a safe medication to have on standby given your other comorbidities. If you have high blood pressure on multiple medications, you trend towards higher blood pressure, may not be the safest option, but work with your provider team on that. Cold compress, cold shower, Sudafed medication therapy. Some individuals actually describe doing some jumping jacks or physical activity, something that will kind of circulate the blood flow away from the penis and deliver it to other areas of the body. Again, I don't have any hard and fast evidence to say that that is truly a beneficial thing, but anecdotally, that's been things that have been described. If it's ever pushing 4 hours and there's any question, contact your provider team because they can also walk you through some options and the best place to be seen.
Alrighty, sounds good. Next question here. Does increasing the injection volume give longer lasting results, or does an increased amount interfere with ease of ejaculation?
So we'll handle that question in a couple parts, okay? So does increased injection volume impede the ejaculation? Is that the question?
Yeah, so they want to know if increasing the volume of the injection will give longer lasting results, or would this in turn interfere with ejaculation?
Yeah, so It's variable from individual to individual. I mean, the ejaculatory mechanism is typically covered by some of the other nerves that are supplied there. Some individuals, again, if you're finding the right dose, that's the key, the right dose. You are trying to get to a point where that dose, that rigidity, is not necessarily impacting some of the other events like ejaculation, and that's not becoming too long of an erection that's becoming painful, that would decrease kind of sensation or decrease in ability to kind of reach climax. Increasing the dose doesn't necessarily have a hard and fast impact on ejaculation or orgasm necessarily. It's all about finding the right dose. So start low and kind of build up to that response.
Alrighty. Next question here. How does testosterone levels affect injection effectiveness?
Yeah, so very good question. There are other things outside of blood flow issues that can impact erectile strength or libido. One of those being testosterone or hormone values in the body. So most individuals' testosterone sits at a good steady state level in the system. But there are some changes that happen to testosterone levels naturally as we age. So you may see an age-related decrease to testosterone or other factors that impact that. So if you have lower testosterone, it may be more difficult to generate or maintain an erection. You may have less libido, and there can be some other effects that are typically associated with that as well. So having a conversation with your provider team about what are my testosterone levels? Are these things that can be also modified alongside some of the medications I use to increase the blood flow to the penis is a worthwhile endeavor. And it's a simple blood test many times to detect testosterone levels.
Alrighty. Next question here. What do you do when you have no reaction from PDE5s, but you have an overreaction from a weak and very tiny injection?
Yeah, so very good question there. So I would basically say, it's important to kind of note what formulation or strength you're using for the trimix injection therapy. PDE5s are the pill forms of medication. So there are a few different variations of this for Viagra, Cialis, Vardenafil, which is Levitra, and Stendra, which is Avendil. So these medications basically help to dilate the blood vessels. If you're not reaching to where you need to get to on a pill form of medication, injectable therapy remains a good option for you. Many times we'll start you out at a standard dose of what is in that trimix medication, concentrations of each component of the medication in there. If you had a very robust response to even a small dose of the trimix formulation, that standard dose, we would typically try to decrease that strength of the medication. And as you saw in the slideshow presentation, there are a number of different ways that we can do that.
Alrighty. Next question here. Saw this a few times. What can you do about scar tissue that grows around the injection areas over time?
Yeah, so again, one of the key points here is to try to vary the area that you're doing the injection. Again, the ideal zone would be to do it on the base of the penis at the 1/3 mark. You can also do the other side in some situations as well. But, if scar tissue is forming there or you're noticing a hardening there, sometimes people can get a bending or kinking of the penis if that's the case. There are ways to address that, therapies to use. Sometimes topical formulations can be used, or creams. Sometimes an injectable therapy may help to also dissolve away that plaque. I would say it's a case-by-case scenario, and typically would want to engage with your urologic provider as to what the best option for you would be.
Alrighty. Next question here. Why is the max number of injections advisable over a 1 week period, 3 to 4?
Yeah, so for a similar reason which we just talked about, we're trying to minimize the in and out of even a small needle puncture into the penile tissue. Because each time that you put that needle in, it's a very low risk and a very low inflammatory response. But any inflammation that's there does have a potential to, develop some scar tissue over time if you're doing this very, very frequently. So we don't want to dose more than once every 24 hours for not having too much medication in the system before the last dose is processed. That's one reason. But the second is to try to minimize in and out with needle punctures into the penis. If we're doing it too frequently, it may increase the risk of scar tissue formation.
Alrighty. Next couple questions we got are about injection accessories. So this person says they have an inject ease device. They're wondering if you can demonstrate the correct way to use this.
Absolutely. So as kind of hinted in the demo portion here, I'll pull out kind of our injectees. This is the option that's available through MenMD. So it comes in a box like this, okay? And this is basically made to help us with our injection therapy, to make sure that we're getting the right depth of penetration, to make sure that the needle punctures are as easy as possible. So I basically kind of assembled an option for you, but there's a couple ways that we can modify this device, okay? So again, this is meant to kind of regulate the amount of needle tip that's coming out, as well as make this kind of a straightforward, reproducible way to do these injections over time. So what you'll notice is that there's a cap component here, okay? And there's 3 different caps that come with it, depending on the type of syringe you have. So we have a standard kind of 50 unit syringe, so we're going to use the one that says 50. There's a 100 unit syringe, and there's a 30 unit syringe tip as well. So make sure you have the right one for the right syringe you're using. In terms of how much needle goes in, if you've been given a certain length of needle, we can also order shorter syringe length needles, but you can also, the device comes with these small rings called spacers, and you can put a spacer on that then kind of minimizes how much needle comes out of the tip, okay? So you can modify that accordingly. And so at the back part of the device is basically a component that you can release a syringe that's there or kind of close the syringe tip. I'll use kind of this standard needle here that we have. We're going to draw up the medication to the desired amount, okay? So say we have a 20 cc, desired dose here. We're going to basically put the needle in its capped form, okay, into the syringe. At the top part here, I just want to make sure that you guys can see this. You basically push that in, okay, and it clicks into place. If we ever want to release that, you simply kind of pull the tab and it pops out. But we click it into place, all right, and then we basically will push in the device. Let me just release this for us here. And uncap the needle tip here, okay? So once the needle tip is uncapped, we basically will have the needle coming out of the tip of the device here, and then we're ready to put it to the penile tissue, okay? We basically will push that in the desired spot, and in one foul swoop kind of employ the needle. And then basically when we're done with the syringe, we can pop the top here, and the syringe comes out. If you have the sharps container, I would just say put it right in the sharps container. And the device can basically be wiped or cleaned with a little cold or damp towel and soap, and then can be easily stored in your injection kit for secondary use.
All right, awesome. So next question here about accessories. This person's looking for a recommendation as far as the best brand name for syringes.
Yeah, so I mean, in general, there are a few different varieties of these. This is oftentimes the brand that we will use through our offices, but Sure Comfort is one that I typically trust. These are insulin-based syringes, meaning they're small needle punctures. They typically come with easy to read kind of dosing on the side, so each unit, should be basically easy to read and easy to measure. This is the brand that I typically trust here. But, everybody's a little bit different there. The one nice part about this, too, is the Sure Comfort brand also comes with a couple different varieties for needle length, as well as varieties for, how much each syringe holds. So this is the brand I typically use.
Alrighty. While we're on the topic of needles, I have a question here. How can I avoid bending the needles? I'm using a 28 gauge for size.
Yeah. So good question there. So the reality is, right, the smaller the gauge of the needle, the more likely it is to be a little bit flimsier and bend a little bit more. So the best ways to do to minimize kind of a bending of that needle would be every time that you're pushing it into the diaphragm or pushing it into the penis, okay, you want to come in at a perpendicular angle or a straight angle, okay? So the straighter that you come, the less likely it is that you'll bend the needle in either direction. Same thing when you go into the penis tissue from that standpoint. You want the penis on stretch, you don't want any redundancy, and you want just a steady perpendicular push into the penis, okay? You want to try to avoid excessive force. If it's not going in for some reason, just take it out and then try to go in at a straighter angle, okay? That would be one of the kind of key ways of doing it. The other one would be if it's really a problem with bending with a smaller gauge needle, you can always go up to a slightly larger gauge needle that may be a little less flimsy or bend a little less often.
Alrighty. And a follow-up to the follow-up. So this person's wondering why they might feel resistance at the plunger when injecting in the recommended areas.
Yeah, so a couple of different reasons for that. Again, what I would always make sure of is, again, the penis is kind of on stretch. There's no redundancy in that area. Make sure it's an area that we haven't kind of heavily used before and that there's no resistance getting the needle into the penis, which could indicate like a scar tissue. You oftentimes could feel something like that as a hardening on the skin surface or underneath. If that's the case, just aim for like a slightly different area. In terms of resistance, in terms of the plunger deployment, sometimes, okay, when the plunger is basically first deployed or pulled out, there may be a little bit of stickiness to that kind of plunger mechanism, okay? What I oftentimes will recommend is you can kind of pull back a little air, you can kind of push it, just loosen up that mechanism, and then when you're ready to draw in, you make sure that the plunger tip is all the way to the top, you kind of push in, and then you draw out what you're going to draw out, and then basically, the plunger should move a little bit more freely when you've broken that mechanism there.
Awesome. All right. So next question here. Can I inject a half dose on each side or another dose after the first?
Yeah, so very good question there, okay? What I would say is what matters is the cumulative dose, meaning that if you were told to kind of start at a 20 unit dose, okay? I come right to the 20. You could do 10 on one side, you could do 10 on the other side of the penis, okay, but it's 20 total. The reality is, okay, so the physiology or the anatomy on the inside of the penis, if you inject on one side of the penis, there is a cross circulation between one side of the part of the penis that fills with blood flow, one cylinder to the other. So medication going in one side typically gets delivered to the other as well. So it may not be necessary to go half and half on each side, unless you're noticing a significant difference in terms of rigidity of one side versus the other.
Alrighty. Next question here. How do you deal with injection anxiety?
Yeah, so a very common question, okay? And I typically state this as, this is, in general, putting a needle into a sensitive area like the penis is always a hard thing to wrap your head around. We deal with a lot of these types of conditions, in the urology space. People get cameras or things like that. It's a hard thing to kind of wrap your head around. I think the biggest thing is work with your provider team, okay? Make sure that we can kind of go over some of the technique, make sure you're comfortable with it, because the reality is, okay, most individuals who do this, they're not sure how they're going to react to this to begin with. Almost everybody has that thought. But I think the majority of individuals who get going with this find that it's a relatively straightforward, painless, and easy to use type of mechanism. And the more that you do these techniques or work with your provider team to feel comfortable with it, it's like riding a bike. The more that you ride the bike, the easier it becomes. And should be a pretty straightforward technique. We try to do a lot of things to minimize, issues that you may have with this, but we're here as resources for you.
Certainly. Alrighty. That was our injection technique section. We're moving on to a couple of our one storage question here, really. So can Trimix be frozen to increase the shelf life?
Yeah, so I would not recommend freezing the medication or keeping it at room temperature. The ideal situation is that many of these medications kind of store best at a certain kind of refrigerator type temperature. And so a happy medium is kind of where you want to store that. I would not recommend freezing it because the likelihood is the dethaw process may actually denature some of the medication for you.
For sure. I got one more storage question here, which I thought was pretty interesting. This person wants to know, is there a more portable medication available, something not necessary to refrigerate?
Yeah, so the majority of bimix, trimix, or other formulations of these medications are typically refrigerator based because what we found is when they do a side-by-side comparison of room temperature medications to refrigerated medications, the shelf life tends to increase because that chilled temperature stops the components from kind of not acting the way that they would typically want to act in the body. As to date, we don't really have room temperature options from that standpoint, but there's constantly things that are being developed, so stay tuned on that.
Alrighty. Next question here. Is it okay to use injection therapy while taking tadalafil 20 milligram pills?
Yeah, so I would tell you in general that most providers are going to want to not muddy the water, so to speak, from that standpoint, because the likelihood is these medications kind of have similar mechanisms of action. At least some of the components of trimix may work the same way as PDE5 inhibitors, which are tadalafil. So if you're putting a medication as a pill into your body, okay, that medication is a certain amount in the body. Then you inject a similar type of medication into the penis, that's kind of double dosing the medication or increasing the dose more than the desired amount. I would tell you not typically recommended because it may be a little bit harder to figure out what the appropriate dose would be. A much safer technique in my mind would be to find the right strength of the trimix that's going to work for you and the right dose so you don't have to take the pill alongside it.
Alrighty. Next question here. I received radiation for prostate cancer about 6 years ago. Am I a candidate for ICI therapy?
Yeah, so absolutely. And actually, one of the very common indications for this would be individuals who have either had prostate surgery for prostate cancer or a radiation therapy that can also affect some of the blood vessels or nerves to the erectile body. So yes, absolutely nothing to say that you wouldn't be a candidate for this. And it's again trying to figure out the right dose to start you out with and the right dose that's going to work best for you. Many individuals who kind of go down that route, they may not be able to reach desired responses with pill forms of medication, whereas injection therapy really tends to be more effective in that type of scenario. So absolutely.
Alrighty. Next question here. Are there formulas for injection medication if bimix or trimix isn't quite working?
What was the last part of the question?
I think they're looking for an alternative to trimix or bimix if they're not having success with those medications.
Yeah. So again, I would basically make sure that you have maxed out in terms of the dosage of trimix to see the desired response. There is a formulation that includes another ingredient sometimes used called quadmix. It has another component called atropine that works kind of similar, but a little bit of different mechanism to the other components of trimix that kind of, maintain a stronger kind of smooth muscle relaxation that then delivers better blood flow into the penis. So that may be one option. Quadmix also comes in a couple different formulations. Other options that exist, though, if we can't get you to where you need to on injection therapy, we think about injection therapy plus a penile constricted band to hold the rigidity into the penis, or other options like an inflatable penile prosthesis or kind of other surgical options there.
Alrighty. Next question here. Is there, generally speaking, a maximum dosage that should not be exceeded for injection therapy, or is this something determined by urology?
Yeah, something to be determined by the strength of the formulation that you're on and kind of what the recommended increase or kind of maximum dose would be. There are some formulations that we typically say, listen, if I've gone all the way from, I started out at say 20, okay, that's kind of my first dose, and I've kind of stepped up 5 every time, and I'm kind of reaching the end of my syringe at 50, well, at that point, if I'm still not getting desired response there and I'm using that much quantity each time I go, maybe I need a stronger formulation. So there are ways to kind of figure that out as we're going along, finding the right concentration of the medication as well as the right dose, but not a hard and fast, this is a rule for everybody.
Alrighty. Next question here. What is the difference between injection therapy, as we've been discussing, and intraurethral gels?
So intraurethral gels, or they also make suppositories called MUs, are basically medications that, if you look at the penis model, basically go into the penis itself. Okay, so there's either a jelly form of this medication that delivers a vasodilation or a blood vessel dilation to give you a more rigid erection, or there is a suppository, like a little pill that gets put in with some lubrication into the penile urethra. Those medications, they diffuse the medication across the urinary tube into the parts of the penis that fill with blood flow during an erection. It's a little bit less direct there. Much of the data actually supports that an injection form of the medication may be a bit more effective in terms of getting the desired response.
Alrighty. Getting to the end of our event here, so we got time for a couple more questions. Next question here. Did I understand you to say that external stimulation is best when using injection therapy?
Yeah, so essentially with pill form of medication or injectable form of medication, you may get a rigid erection just from the dilation itself. But remember, there's a natural physiologic mechanism that works by using the nerves that normally stimulate a relaxation of the muscles. So stimulation is definitely helpful to achieve desired response, working your body's normal pathways in addition to putting the medication that will help with the dilation of the blood vessels.
Alrighty. Next question here. If you stop using injection therapy at some point along your journey to ED treatment, will you lose the size of penis over time?
So it's not a use it or lose it type of situation. There are some factors that can cause length decrease over time with the penis. Sometimes, if you look at the penile model, there are some ligaments and some tissue that kind of keep the penis externalized. The cylinders that fill with blood flow in the penis to give you an erection, they don't necessarily decrease in length over time, but they may become more internal to the body with age, as some of those tissues become a little bit more lax. Sometimes abdominal or truncal obesity may also make that process occur. So in those types of scenarios, it's not that not using injection therapy is the thing that's causing that. It's typically another scenario.
Alrighty. We've got time for one more question. So our closing up question here. At what point does a person consider a penile implant?
Yeah, so penile implants may be, appropriate upfront options for individuals who have been thoughtful about this, who don't wish to try to engage in injection therapy or have other considerations for not doing that, such as prone to penile scar tissue or things like that. Penile prosthesis can also be a good option for folks who are just not getting a fully rigid erection despite using kind of higher strengths of trimix formulation or injectable therapy. So it typically tends to be a later line option, but could be appropriate for some individuals who, again, just desire that as kind of an upfront option. It is a surgical option. The injection therapy tends to be less invasive, but is a good option for some individuals who just can't reach desired results or kind of wish that therapy.
There are also more resources in the Resource Center on menmd.com. Visit this page to view instructional videos, guides, expert articles, and more. You can also call MenMD at 857-233-5837 or log in to the MenMD portal to schedule an appointment with a MenMD personal health assistant. If you're interested in injection accessories, you can learn more or purchase accessories on the shop page on menmd.com.